done this in terms of graphs rather than I presented this in terms of regression coefficient. It's just that the regression coefficient is a much easier, quicker way of showing how the mean value of height for age differs across these different groups. Because that's all we're doing here. We're just comparing mean values of one group with mean values of another group. I wish I could do. I wish we could do more. And if you have any ideas, we'd be happy to explore it. I know originally a lot of our colleagues were saying, oh, you should include regional dummies in here. You should include other controls, basically. But they tend to forget the fact that the reason you include controls is basically to reduce the endogeneity bias, which is something that there's no way we can reduce here. So anyway, that's sort of my complicated answer to your simple question.
Okay, actually it's already 12, but I'm sure that we're still very enthusiastic to have a discussion with Emmanuel. And for that, I would like to offer 3 more questions before we finish the discussion. Yeah, Ibu. Name and institution?
My name is Yuyu. I'm from the GPAI. GPAI, Jaringan Peduli Anak Indonesia. Yes. Yeah. I will ask about your graphic on adequacy resource rich versus resource poor Bangladesh in 2010. And based on the result, I think I saw in the presentation about the component of the 3 of the pillar, that's like the component of care is higher than the others. Because in here, this only available component only 2. Caring behavior, breastfeeding, and the others is a complementary feeding. And the other components, they have a lot. For example, at the good food, they only have a 3, and the environment, they have 7 or 6. And this is actually like unfair for the graphic because the other only have a 2 component and make higher. But how to make sure like psychosocial care in here, how to mean of verification on that? Because for me, this is it's quite difficult to provide the data about what the psychosocial care and also for the social support to caregiver. That's a very difficult. And how in future we make sure about the indicator, real indicator in the community, maybe also with the government to provide how they can provide information to fill in the component of care and also for the other pillar. That's a very important because if you just mention like this, I think they never achieve the good result for their 3 pillar in future. That's my.
I agree with everything you said. It is true that we certainly need, at least my plan is for Indonesia, when we do this with Skoufias 2007, 2013, we're going to try also, we have to see how the picture looks like when we have exactly the same number of indicators for each of the groups, each of the 3 or 4 groups. Because then you have a fair sort of, but you know, the problem is that this will punish the groups that have more indicators and will work in favor of the groups that have only 1 or 2 indicators. But by doing a few combinations, we'll see how the story, whether the results really change dramatically or not. But you know, this analysis is not perfect, and these kinds of issues have never been looked systematically by researchers. I'm sure there's a general, somebody smart someday will do a very systematic analysis of mathematical and sort of combinatorial sort of issues involved in how many indices you put in every group and how that bias is in one way or another. The numbers are the same. But all I know, and at least I got comfort in, is that the same issues arise in the multidimensional measurement of poverty. Because nowadays, poverty in most countries, in many countries, especially in Latin America, is not measured by income or consumption anymore. They want to come up with one number that takes into account all the different dimensions of poverty, which basically means income and consumption and access to health and access to education and all these things that you think are associated with poverty. So, and again, the approach there in multidimensional poverty is basically the same. They say, okay, we have three groups that are important for poverty, and then you put variables in each group, and then some groups have more variables than others, and then comes the issue that the answer is driven by the groups that have less variables, like in this particular case here. But anyway, this is an ongoing effort, and we're not the only ones that have these problems. That's the only comfort I can offer.
Any other question, maybe? Bye.
My name is Hemi and I'm from SMERU. My question relates to the appendix about thresholds for water examination. In the page 56, there is indicators for improved sanitation, community sanitation, access to safe water. And I was interested for the Indonesian ones where for improved sanitation you put yes and community sanitation no and access to safe water yes. First question, for what is the difference between improved sanitation and community sanitation you use in this research to define yes and no for these two indicators? The second question relates to access to safe water, because in the page 54, I see that the indicators of improved source water include several stuff there, and as long as I understand the situation in Indonesia, it is very likely that from my understanding, it is included in category of unimproved source water instead of improved one. But in your indicator you put as yes. So I'm wondering what decision, like how you decide yes for the access to safe water. Thank you.
Yeah. We've improved a lot in our treatment of how you define improved sanitation and improved water since we did this study. We are currently there's a big study going on in the World Bank exactly on the issue of improved water and improved sanitation. Diagnostic, if you like, in Indonesia. And we are using exactly now the definitions, this diagnostic, we're using exactly the definitions of actually two versions of the definition. one is the government of Indonesia definition, which is not exactly the same as the joint monitoring program. You heard of the joint monitoring program for water and sanitation? That's an international sort of body that defines what is to improve water and improve sanitation across all countries, for the MDGs and for the SDGs, for the Sustainable Development Goals. The Indonesian definitions are not exactly the same as the ones of JMP. So now, and therefore, that forces us to do the analysis with the two definitions, one for the Indonesian and one for the international comparison. Now, so when we do this analysis with the Skoufias now, we are going to be paying a lot much more careful attention to these exact definitions of what is improved water and improved sanitation. Now, the other part of your question was about community, how you define community. That, here we said no, because when we did for Indonesia, when we did the Skoufias, there was no way to come up with the percent of the population that has access to improved water and improved sanitation at the community level, because we didn't have community identifiers. The Skoufias, the best we could come down to was state, I think, right? And they didn't give us identifiers for that's in the 2010. We did not have identifier for Kecamatan, for example. And that's why we would not be able to calculate it at the community level. That's why we said no. But again, now that we are redoing the analysis in 2007 and 2013, we can calculate community down to the block census level. And we're going to have the percent of households in the block census that has access to improved water. And again, improved will be with the government of Indonesia definition and the joint monitoring program definition. And improved sanitation. The same, 4 different combinations that we will address in detail. That's why, as I said, again, this study you should, I urge you to look at it more as an appetizer, if you like. The true meal should be when you do a country-specific study with the better data sources for the country, which now we're hoping to be doing with the Ministry of Health.
Another question, maybe? Okay, one more question. The last question.
Thank you. My name is Irene.
My name is Irene. I am from TNP2K, the national team for the poverty reduction. I know you have said several times that this is an exercise and maybe further studies needed, for especially for Indonesia later on to be able to determine, for instance, like which synergies are going to provide a better effect. But I was just wondering, looking at the result of analysis figure 11 and 12, just trying to be able to interpret the result. Is it true that from these two graphs, 11 and 12, and the other one, 12, is it true that from those two graphs showing that synergies which between two variables which is quite positive, it doesn't always shows a good total effect. Like for instance, for the case of Indonesia, we can see that food and care in figure 11 actually showing a positive coefficient, but then when we look at the total effect, it actually doesn't show a total effect. So does it mean that good synergies doesn't always show total effect on the food, on the child nutrition? Or
well, again, just you have to look at this, right? The total effect is all these things summed up. Right? The synergies is just this coefficient. So figure 11 is basically this coefficient only. Right? And if you're really worried about synergies, and if you want to sort of make the point that the synergies are important, maybe we should stop there and just say, okay, I showed you the coefficients, gamma 1, gamma 2, etc. And they're all significant and positive, and leave it at that. But, yeah, we decided to go a step further and say, okay, what is the effect on the, what is the mean, the actual value of the mean, for those who have access to two, in this particular case, care and food, and what's the actual value of the height per inch, the mean value of height per inch for those who have access to 1 and 1, right? So then you know, some of these beta coefficients here are negative, right? And these have to do with sample sizes in these cells, right? The groups that, the number of children that have access only to 1 only, or 2 only. So, yeah, in principle, all of these should be positive, but they're not. And then when you put them all together, sometimes you get a negative. That's what figure 12 shows you. The total effect is negative, because it turns out that this may be negative, and then this may be negative, and even though it's positive, overall, the sum is a negative number, which is strange. But we did get these results. I don't know what to do with them. We recorded it. Yeah, but the more encouraging thing, and perhaps that's where we should have stopped, is that these coefficients here, because these are the ones that are talking about synergy, are the ones that are positive and significant. Again, not everyone is significant, positive, but again, some appear to be negative. But majority is 18 out of 25. Yeah, 18 out of 25. They're positive, and then 10 out of 18 are significant.
Have you satisfied with the answer? Okay, I think we come to the end part of the discussions. Try to sum up. Emmanuel's paper tries to emphasize the interrelationship among the adequate food security, health and nutrition, and care practice, to the prevalence of the nutrition in some of developing countries, including our country, Indonesia. I think this is very important and very insightful for us, because it provides us a new insight about the importance of the multi-sectoral intervention to solve the problem of nutrition. Yeah, we know this is, for our country, this is very problematic, sir, because of we are still struggling with the ego-sectoral issue and also poor coordination. But you said that to overcoming malnutrition, it needs serious effort, and one of the key that you have mentioned is good quality data and information, so that it can help us, help maybe the decision maker to better look at the problem of nutrition, maybe to be able to look at with a helicopter view. Yes. Yeah. I think the time is up, and thank you very much, Emmanuel, for your very insightful presentation, and also you can just approach Emmanuel because uh, we still have a chance to meet him during the lunchtime. Okay, I think now we can. Oh, yeah. Before we finish this, there's Emmanuel. There's some gift from SMERU. Pak Asep, you are pleased to present the. Thank you very much, Pak Emmanuel. And also thank. Oh yes, another announcement. This is from. There's an announcement from SMERU. Yes. The SMERU Research Institute having a cooperation with the Indonesia project at the Australian National University, and we are going to organize the 4th Indonesian Development Research Network Workshop 2016 in mid-May in Indonesia. For that, we are inviting a submission for paper presentation and proposal for research grant 2016-2017. And for more information, please visit SMERU website at www.smeru.org.id. Okay, thank you very much. And so we can now moving to another most anticipated agenda, the lunchtime.